Ever choked on a piece of food? We've all been there, right? That sudden panic when something goes down the wrong way.
It's a feeling that reminds us just how important swallowing is,
It's something we do hundreds of times a day without even thinking about it.
until it stops working properly.
Exactly. And that's what we're diving into today, this seemingly simple act of swallowing and what happens when it goes wrong, a condition called dysphagia.
And it's more common than people might realize. Millions of people experience some form of swallowing difficulty.
So today we'll uncover why something so fundamental can become a problem, what to look out for, and what can be done about it.
It's a fascinating journey, actually, uncovering the interplay of muscles, nerves, even our immune system in this everyday act.
So where do we even begin? When we're talking about something as seemingly straightforward as swallowing, what are we even talking about when it goes wrong?
Well, it's helpful to remember that dysphagia is rarely a standalone condition. It's usually a symptom of something else going on in the body.
Okay, so like a check engine light in your car. It's a sign that something needs attention.
Exactly. So let's start unpacking this. What are some of those red flags, those signs that something might be off with how we swallow?
Well, I imagine that feeling of food being stuck in your throat is a pretty big one.
Definitely a major one.
Mm.
But dysphagia can be sneaky. It can show up in ways you might not expect. Have you noticed that you have a consistently hoarse voice? Or maybe you're drooling more than usual, experiencing unexplained weight loss, things like that.
Wow, I never would have connected those things to swallowing. It's like our bodies are trying to send us a message, but we don't know how to read the language.
Exactly. And once we start paying attention to those subtle cues, we can start addressing the root of the problem.
So let's talk about those roots. What actually causes this intricate process to go off track?
Well, the sources we're looking at today mention a whole bunch of potential culprits. It really runs the gamut from, well, things we might not think twice about, like poor eating habits.
Hold on, are you saying all those years of scarfing down lunch at my desk are coming back to haunt me?
It's more common than you'd think, but we're also talking about more complex factors like acid reflux, scar tissue, esophageal spasms. And then there are conditions like eosinophilic esophagitis.
Eosinophilic what now? That sounds intense.
It's a bit of a mouthful, literally, eosinophilic esophagitis, EOE for short. It's a chronic allergic condition. Basically, certain white blood cells, called eosinophils, they build up in the esophagus.
Okay, hold on a second. My esophagus can have allergies. That's news to me.
It might sound strange, but remember, our immune systems are always on alert, and sometimes they can misfire.
Okay, so it's like my immune system is launching a full-on attack on my esophagus.
In a way, yes. In the case of EOE, these eosinophils, they cause inflammation, which leads to difficulty swallowing, pain, and that dreaded feeling of food getting stuck.
Wild. But if swallowing involves all these muscles and nerves, wouldn't things like neurological conditions or even physical injuries also play a role?
Absolutely. Swallowing is a complex sequence of muscle contractions, and it starts in the mouth and moves all the way down to the esophagus. Anything that disrupts that delicate dance, whether it's a stroke, a traumatic brain injury, even nerve damage from certain diseases, can lead to dysphagia.
It's like one of those domino effects. One thing goes wrong and the whole system is thrown off balance. But when we're talking about the mechanics of swallowing, wouldn't the location of the problem influence how it's diagnosed and treated?
You're spot on. It's helpful to think of dysphagia in terms of where the issue originates. We can break it down into three main types: oral cavity dysphagia, or pharyngeal dysphagia, and esophageal dysphagia.
Okay, let's break those down. Oral cavity dysphagia, that sounds like it's all about the mouth, right?
Exactly. Problems of chewing, controlling the food in your mouth, or moving it to the back of your throat. Think tongue weakness after a stroke, or issues with the nerves and muscles in the mouth.
So it's not always about food getting stuck further down. It can be about those initial steps not working correctly. What about oropharyngeal dysphagia?
That points to a problem in the throat, that area at the back of your mouth where swallowing actually happens. This can be caused by a neurological issue, a muscular spasm, or even structural abnormalities. Sometimes, for example, the epiglottis, that little flap of cartilage that covers your windpipe when you swallow, doesn't function correctly, and food can end up going down the wrong pipe.
Which is why we sometimes cough or sputter when that happens. Okay, so that covers the mouth and throat. What about when the issue lies further down in the esophagus? That's esophageal dysphagia, right?
Exactly. This often involves problems with the esophagus itself, things like a narrowing, which is called a stricture, damage from acid reflux, or, in more serious cases, even tumors.
Tumors in the esophagus, that sounds incredibly scary.
It can be, which is why it's so important to pay attention to persistent swallowing difficulties and seek medical attention if something feels off.
Absolutely. Early diagnosis and treatment are key. But speaking of causes, we've got to circle back to this eosinophilic esophagitis, or EOE, you mentioned earlier. You said it's an allergic reaction. What exactly triggers it? Is it certain foods, environmental factors, or something else entirely?
That's where things get really interesting, and it's something researchers are still trying to fully unravel. We know that EOE is more common in people with a history of allergies, especially asthma, eczema, and food allergies, but the specific triggers can vary widely from person to person.
So it's not as simple as saying, okay, if you have EOE, just avoid peanuts, like you might with a peanut allergy. It's more complex than that.
Exactly. It often involves a process of elimination, working with a doctor, potentially an allergist, to really pinpoint your individual triggers.
That sounds like a detective mission for the digestive system. So we've got these various causes, from poor eating habits to allergic reactions to more serious conditions like tumors. But before we dive into diagnosis and treatment, let's talk about the actual experience of dysphagia.
Because it's one thing to understand it from a medical standpoint, but it's another to truly grasp how it impacts people's lives.
Exactly. What does it actually feel like to live with this condition day in and day out? It's got to be more than just an inconvenience.
Oh, absolutely. It affects every aspect of life. Imagine even something as simple as sharing a meal with loved ones. That becomes a source of anxiety.
It's heartbreaking to think about something so fundamental being disrupted. Makes you realize how much we take for granted.
You said it.
So let's shift gears a bit and talk about what can be done. When someone suspects they might have dysphagia, where do you even begin to unravel something this complex?
Well, it all starts with a conversation with a medical professional who understands swallowing disorders. They'll want to hear your story, understand your symptoms, and really delve into your medical history.
So it's like piecing together a puzzle to get the full picture.
Exactly.
What happens after that initial conversation? Do they break out the tiny cameras and go exploring right away?
Not quite. While a visual examination can be helpful, it's not always the first step. Doctors often start with less invasive methods to assess swallowing function. One common approach is a bedside swallowing evaluation. This is where a speech-language pathologist, an SLP, will observe you swallowing different consistencies of food and liquid.
So it's like a taste test, but for science. What are they looking for during this evaluation?
They're paying close attention to how you handle different textures, whether you cough or choke, if there are any signs of aspiration, which means food or liquid entering the airway. They might even feel your throat as you swallow to assess the movement of your larynx.
Wow, it's amazing what they can tell just by observing. But what about those cases where a closer look is needed? That's where the tiny cameras come in, right?
Exactly. If that bedside evaluation suggests a more in-depth look is needed, the next step might be something called a video fluoroscopic swallowing study. VFSS for short.
Okay, you're going to have to break that one down for me. That sounds like something out of a sci-fi movie.
It's not as complicated as it sounds. It's a real-time X-ray that lets doctors see how food and liquid travel through your mouth, throat, and esophagus as you swallow. You're given different consistencies of food and liquid mixed with barium, which shows up clearly on X-rays.
So they basically give your digestive system its own mini-movie. That's pretty cool, actually.
It really is. It's a powerful tool that can pinpoint the exact location and nature of the swallowing problem. And speaking of powerful tools, there's another procedure called esophageal manometry.
Okay, now we're back in familiar territory. The esophagus. Remind me again, what is that exactly?
Right, so the esophagus is that muscular tube that carries food from your throat down to your stomach. And esophageal manometry measures the pressure and coordination of those muscle contractions in your esophagus as you swallow.
So it's like taking your esophagus to the gym and measuring its performance.
Exactly.
Yeah.
And it can give us valuable insights into how well your esophagus is functioning.
It seems like there's a whole world of diagnostic tools out there that most people don't even know about. But once the detective work is done and the culprit behind the dysphagia is unmasked, what comes next? What are the treatment options?
That's the good news. There's a whole arsenal of treatments available. And the best approach really depends on the individual and the underlying cause.
So there is no one-size-fits-all solution.
Exactly. It's about finding the right combination of tools to address each person's unique situation.
I like that. Personalized medicine.
Exactly. For some people, simple lifestyle modifications can make a huge difference. We often underestimate the power of slowing down, chewing our food thoroughly, and taking smaller
Oh,
bites.
you're speaking my language. I am definitely a member of the Inhale My Food Club.
I think a lot of us are guilty of that. But being more mindful about how we eat can actually do wonders for our swallowing.
So it's about listening to your body and figuring out what works best. But what about those cases where lifestyle changes aren't enough? What other options are on the table?
Well, if acid reflux is a contributing factor, medications like proton pump inhibitors, PPIs, can help. They reduce stomach acid production, give the esophagus a chance to heal. And if a stricture, a narrowing of the esophagus, is causing the problem, a procedure called esophageal dilation can be performed.
Esophageal dilation. That sounds kind of intense. What does that entail?
It involves using a balloon-tipped catheter to gently stretch the narrowed area of the esophagus, improve its ability to transport food.
So it's like giving your esophagus a little pep talk, encouraging it to open up.
In a way, yes. And it could be a very effective way to improve swallowing function.
But what about those more severe cases we discussed earlier, like tumors or neurological damage? Are those treatable as well?
Those cases can be more complex. Surgery, radiation, and chemotherapy are all potential treatments for esophageal tumors, and the best approach is determined on a case-by-case basis.
Again, it's about tailoring that treatment plan. What about neurological damage? That sounds incredibly challenging to address.
It can be. Neurological damage affecting swallowing is complex, and treatment often focuses on helping individuals adapt and develop compensatory strategies. Speech therapy can play a crucial role here.
Speech therapy. So it's not just about learning how to pronounce your R's correctly.
No, not at all. Speech-language pathologists, SLPs, are experts in swallowing and communication. They can teach patients targeted exercises to strengthen those swallowing muscles, improve coordination, and develop strategies to compensate for any lost function.
So it's like physical therapy, but for your swallowing muscles.
Exactly.
That's amazing. It seems like SLPs play such a critical role in helping people regain control over this vital function. But what about those who might not have access to specialized care right away? Are there things people can do at home to manage dysphagia?
Absolutely. One of the most important things is modifying food textures to make swallowing safer and easier. Things like pureeing foods, adding thickeners to liquids, and avoiding foods that are particularly difficult to swallow.
So working with what you've got, finding ways to adapt. Are there any specific foods that tend to be more challenging?
Yeah, foods that are dry, crumbly, stringy, or sticky can be particularly troublesome. Think dry meats, crunchy snacks, stringy vegetables, sticky candies. It's often helpful to actually keep a food diary to track which foods you find most difficult.
That's a great tip. Knowledge is power, right? But even with all these strategies in place, living with dysphagia must still present daily challenges.
It does. It's a condition that requires ongoing awareness, adaptation, and a good dose of patience.
And a good healthcare team in your corner, it sounds like having a supportive team of professionals who understand the intricacies of dysphagia can make a world of difference.
100%. From gastroenterologists to SLPs to registered dietitians, there's a whole network of experts who can help.
It's about reclaiming control, right? It's about empowering people to enjoy the simple pleasures of food and drink without fear or anxiety. Speaking of reclaiming control, this deep dive has been incredibly empowering. I feel like I've gained a whole new understanding of this complex condition. But before we wrap things up, I'm curious, what are some of the latest advancements in dysphagia research? Are there any promising new treatments or therapies on the horizon? It feels like every day there's some new medical breakthrough. What's the latest and greatest in the world of dysphagia?
Well, there's a lot of exciting research happening. For example, one area that's really promising is the development of new medications for EOE.
Oh, right. Eosinophilic esophagitis.
Right. So remember how we talked about those eosinophils causing all that inflammation in the esophagus?
Yeah.
Well, researchers are now looking at drugs that specifically target and reduce those eosinophils.
So calming down that immune response.
Exactly. So instead of just managing the symptoms, these new treatments would actually address the root cause of EOE.
Wow. That's amazing. Now, what about those other forms of dysphagia? What about those folks who have swallowing difficulties because of neurological issues or muscle weakness?
Another promising avenue for folks with those conditions is neuromodulation techniques. Things like transcranial magnetic stimulation, TMS.
TMS? That sounds intense. Like something out of Star Trek.
It does sound pretty futuristic. It's a non-invasive way to stimulate specific areas of the brain, and it can actually help improve swallowing function.
Okay, now you've got to explain how that works. Are we talking lasers and brainwaves?
No lasers, but we are talking about using magnetic pulses to stimulate nerve cells in the brain, which can actually help strengthen those weakened connections and improve swallowing function.
So giving your brain a little workout to get those swallowing pathways back in shape.
Exactly. And it's showing a lot of promise.
That's incredible. It seems like we're really entering a new frontier in how we diagnose and treat this. What other exciting technological advancements are on the horizon for this?
Robots.
Robots. Okay, now you're speaking my language.
Right. It sounds crazy, but robotic-assisted surgery is becoming more and more common, and it's starting to be used for certain dysphagia cases too.
Wow. So instead of traditional surgery, we're talking tiny robots doing the work.
Exactly. Robotic surgery means greater precision, smaller incisions, and faster recovery times.
That's incredible. What a time to be alive. It really feels like we're on the verge of some major breakthroughs. But I think it's also important to remember that even small changes can make a big difference.
Absolutely.
And if there's one key takeaway from our deep dive, it's that you shouldn't suffer in silence.
100%.
If you're having any issues with swallowing, no matter how small, it's so important to talk to your doctor.
Early intervention is key.
You heard it here first, folks. Knowledge is power, and asking for help can be life-changing. Now, before we go, I want to leave you with this. We've talked a lot about the science of swallowing and the challenges of dysphagia. But next time you take a bite of your favorite food or enjoy a nice cold drink, think about that complex process happening inside of you. It's a pretty amazing thing. And on that note, thanks for joining us for this deep dive. We'll see you next time.